Hi everybody, Kayla here. If you're new around here, I am a feeding specialist, speech language pathologist, and lactation counselor, and every day I help parents and babies navigate their feeding journey, anywhere from birth and lactation and bottle feeding all the way through childhood. I'm hopping on today to talk about bottles and just some of the specifics about choosing the right bottle. I think that there's a lot of misinformation out there, and I think that a lot of false advertising and false marketing on the bottles that are on the market. And the reality is, I constantly feel like we're having this conversation about breastfeeding versus bottle feeding or formula feeding, and really the reality of the situation is that most babies are going to have to take a bottle at some point. Even if breastfeeding is happening and successful, especially if you're here in the US, we are asked to go back to work, after 12 weeks, if you're a working mom. And so you might be pumping and providing a bottle during the day while you're away from your baby. And so I just think it's really important that as parents, you have the information to know how to choose a bottle that's good for your baby. I'm not here to plug a specific brand. I definitely have my favorites that I tend to use, but what I really want is for you guys to have the information to understand why I choose the bottles that I choose, and for you to be able to go into a baby store, Walmart or Target or Buy Baby, wherever you go to buy your baby stuff, Amazon, and assess whether or not it might be a good bottle choice for your baby. So in order to really understand why I choose the bottles that I choose, you have to have a good understanding of latch. And there are some differences between latching to breast and latching to bottle, but we really want to mimic breastfeeding the best we can. And that's I'm not on a breast is best kick, but there are benefits, and we know that. And bottles are a tool. And if you're using them, we really do need to try to mimic breastfeeding and latch on the breast the best we can. But the reality of the situation is that breast tissue, human tissue, and silicone bottles, they're never going to be the same. So there's a lot of misconception, and it's just some of the stuff I want to talk to you about today. So let's talk about normal latch. So I'm going to simplify this the best I can, because you guys do not need to be experts on latch, but you do need to know the basics, and it'll help you understand the logic behind what I recommend. So when a baby latches, let's say to a breast, the first thing they'll do is, with their rooting reflex, they'll orient themselves to the breast and to the nipple, and then they'll open their mouths really, really wide, tilt their heads back a little bit, and latch on. And when that happens, the tongue comes forward over the bottom ridge of their mouths where their teeth will erupt, and it pulls the breast tissue into their mouths. Babies do not nipple feed, they breastfeed. So they pull that tissue to pretty far back, the back of their mouths, if you feel the top of your mouth and where the bone ends, your hard palate, and where the soft palate begins, they pull it all the way back there. And so it fills up their entire mouth. So tongue is cupped like a hot dog bun around the breast tissue and the nipple tissue, and the cheeks and the hard palate, the roof of the mouth, and the lips and the tongue, it fills up the entire mouth. And that is what we want to try to achieve with a bottle nipple. So let's talk about nipple shape. The nipple shapes that I recommend like a pretty good rule of thumb is I want the bottle nipple to become progressively wider. So progressively wider rather than something that is narrow like a nipple and then all of a sudden gets really, really big. There's no way with this shape that a baby could pull that the silicone fully to the back of their mouths and like completely have no space. And the reason I don't want space is because when there's space, we get air. And when we have air, then we get spitting up and we get gas. So we want the nipple to fill the mouth. And that's why when you give a baby something like this, there's gonna be some air there. And I just really don't believe that a baby can get a really good true latch on a bottle nipple like this. So like I said, I'm not necessarily like, I of course have bottles where I'm like, I really don't want a baby on that bottle, right? Or I have bottles that I really like. So, the Dr. Brown's Narrow is one of them that, as you can see, this is gonna more closely mimic, what the breast tissue would look like inside of the mouth on a latch. And so babies can easily get it back there. It's round in shape, so their tongues can cup around it and then, hopefully fill as much as the oral cavity as possible. And then, the pressures that are used to extract the milk, that's how it happens. That's getting a little bit more nitty gritty into the latch. But so that's what I like. Here's another example. So, this one does get wider at the bottom, but it's progressive. So this is the Lancino, this is the Even Flow. Sorry. The Lancino is another one that is progressively gets wider like this that I use sometimes. But again, so it's not just nipple and then all of a sudden it gets wide. It progressively gets wide, so it's gonna more closely mimic what the breast and the nipple look like inside of a baby's mouth while they're eating. The MAM bottle is one that is really popular, and you might think right off the get-go that like, oh yeah, it progressively gets wider. But what I don't love about this bottle is that it's flat, and so I really don't think a baby's tongue can truly cup around that, and you're gonna get more of like a chewing, munching on the nipple to extract the liquid. So also really not a huge fan of this shape either. The Tommy Tippy is a really good example of that breast-shaped nipple. And you can see I still have it in its package because I'm not even gonna take it out of the package I'm gonna send it back to the store. Basically, I bought it so that I could show you guys. But it's a really good example of false advertising that's out there. So if you can't tell by going to the store and just reading what it says, because this says that it's breast-like shape for a natural latch, but what I just explained to you, like that, it's just not true. And that the smooth silicone feels closer to skin. Nothing feels like skin. And that it flexes like mom for a comfortable feed. It's just kind of like the Komotomo, to be honest. So let's just use that one. Like, it's not gonna flex in the same way as human tissue is. It just isn't. It's silicone, it can't do it. So just be weary of like going into the store and saying like, oh, like this bottle says that it is anti-colic, so it must be good, right? Or this one says it's like breast, it's like mom, so it must be good. As far as I can tell, they can say whatever they want to say, and they're clearly not consulting anyone who knows about oral function, if I'm being frank and honest. The Dr. Brown's wide mouth, they just improved this one. It used to be a no for me, but I have put some babies on this bottle. It depends on the baby, and that's what I mean. I can't just say, oh, every baby should be on a Dr. Brown's narrow nipple, because it doesn't work for every baby, and every baby is a little bit different. It's just that I want you guys to understand the basics of how to pick one out. But so this one does get progressively wider now. So I've had some babies on this and have had some good success with it lately. The next thing that I wanted to cover, that was one of the questions that I got, was about nipple flow. And this is another place where the advertising and the marketing and the companies, like, they just want you to buy more of their stuff. Like, if you go and you look at the nipples, like, they're marketed by age. So like the level 1 nipple will be like 0 months plus, or 0 to 3 months. And then you'll get to the level 2 and it'll be like 6 months and above, or whatever it says. I honestly don't even pay attention to it anymore. But in general, I keep babies on a slow flow nipple unless there's a problem. And the reason I do this is because I want them to be in control of the liquid. Sometimes when the flow is too fast, like, it's just like they're being waterboarded, right? Like, they can't keep up, they have to swallow. And so I want them to be in control of when that liquid is being extracted. I want them to use their oral musculature to get the liquid out. I don't want them to just be passive eaters and like let the liquid fall in and then they swallow. I want these muscles moving. And I want to give the baby a chance to read their fullness cues. So when baby is on breast, they can take breaks, they can stop the flow. It's just a much more controlled situation. And so we need to give them that same control with a bottle. And again, this isn't a breast is best campaign, but the reality of the situation, that is the biological norm, and we want to mimic it the best we can. And on top of that, if you have a baby who is switching between breast and bottle, you don't want a super fast flow on the bottle nipple and then go back to breast. Sometimes a baby they'll develop preferences that way to the bottle because it's faster and it takes less work, to be honest. And so we want to keep it even flow. So all the flow rates on these bottles are different. So I'm not going to be able to say, oh, keep them on this level. But an example is like with the Dr. Brown narrow nipple, like, and again, I use this one a lot. I typically won't move a baby up past a level 1 nipple. Sorry, someone was calling me. I'll keep them on the level 1. And some signs that maybe I need to trial a level 2 would be if they're like consistently collapsing the nipple, or it's taking them a really long time all of a sudden. But in general, with a baby with good oral function and a good latch, I can keep them on the slow flow nipple all the way through weaning. So it really is kind of a false advertisement to think that you need like a level 2 or a level 3 nipple. Might be a little different in the cases of like a baby with a cleft, or, you know what I mean? Like when you get into special circumstances, you really should be working with a specialist anyway. So they'll able to give you good guidance on what your baby needs. The third question and topic that I wanted to cover with bottles are vent systems. So I'm not going to say they're not important. Vent systems are important, so they're there to make sure there's like less air in the bottle, so that again your baby doesn't have excessive spit up or excessive gas, because when we ingest air, we see excessive gas, pain, spit up, and that's where the whole like anti-colic bottle comes into play. But I think that the advertisement of the vent systems, like sometimes we get so caught up on the vent system and keeping the air out of this part of the bottle, we're ignoring that the air is coming from the mouth. And so that is why, first and foremost, like before I consider the vent system, I want to look at the shape of the nipple and if your baby can establish a good latch or not on it. Because if they can't, they will be swallowing air, and that can lead to those symptoms we talked about. So that is all I really wanted to cover today. Those are some pretty basic ideas around bottle feeding. We can do another discussion on positioning and being responsive and pacing, but I don't really have enough time to go into all of that today. So I'm gonna hop off because I have to get going, so I don't really have a ton of time to stick around for questions. But I'm gonna save this as a recording, so if you guys are watching this as a recording, you can pop a question in the comments below, and I'll do my best to kind of pop in and answer them for you. So thanks for joining today, and thanks for listening. Bye, guys.